From cartels at the so-called mafia house to the burden of realizing universal health coverage, this amidst limited resources and expensive healthcare. The Health Cabinet Secretary, Susan Nakhumicha, has a great task ahead of her, tasked with ensuring every Kenyan has access to top-notch healthcare. What lies ahead? The CS spoke to NTV's health and science reporter, Helen Ora, as well as the Daily Nation's Angela Okech.
Madam Susan, welcome to NTV.
Thank you.
It's a pleasure having you here. You hold one of the toughest offices and sensitive at the same time, or rather ministries in the country. What should Kenyans expect from you?
This ministry concerns every Kenyan. Being aware of that fact, then I am clear of what it is that we need to deliver. Our president, on his campaign trail, together with the team, they made a promise to Kenyans on what they are going to do in the health sector. And basically they promise that they will be able to give Kenyans universal health coverage.
One of the key components of NHIF is that we are moving from KEMSA to NHIF to be the funding of universal health coverage. What are your plans for this particular project?
It's not that we are moving from KEMSA to NHIF. No. In this universal health coverage, we need both institutions. KEMSA is a key in terms of ensuring that we have health commodity security, that the commodities and the products that are required in terms of driving healthcare are available. NHIF is another strong pillar in this universal health coverage because it deals with the financing bit of it, that the monies are available to Kenyans to be able to take care of their health. So specifically, we are doing a lot of reforms at NHIF. You know, previously it has been registration and it has been taking care of individuals. So one of the biggest shifts that we are going to do is that now we are taking care of, we are planning to and moving towards household. If you are married, your husband is also employed, you both contribute. But in terms of the benefit, it is one. I want to call upon Kenyans, why don't we put together these funds, do this major fundraising, so that then we stop the small WhatsApp group fundraisers that we are currently having, because we'll have now put the funds into NHIF.
Previously, the Private Hospital Association, there's a point they did not want anything to do with NHIF. And right now, if you step into a private hospital, if you have NHIF, they would not be so keen to attend to you with NHIF, as opposed to if you have cash or a private cover. Moving forward, how best can we be able to handle these issues?
NHIF was providing the financing bit. The facility is responsible for giving you the service. So now they cannot turn around and say we cannot, we are unable to give you proper service because of NHIF. We are shifting the thinking because one, NHIF is not meant to be competing private insurance. It is not. At the moment, that is what is happening because of these enhanced schemes. So we are focusing it and saying, can you concentrate on the hustlers? Can you concentrate on the bottom of the pyramid of this country? Anybody who is down here. So we want to have a national social security scheme in terms of healthcare, that everybody down here is taken care of. You and I, if we can afford private insurance, then we pay for it.
Recently, we've seen the police have shifted their cover from NHIF to the joint consortium under the CIC group. Isn't this contradictory considering we're pushing and driving force for NHIF, but now we're switching to private?
Let me ask you, as a Kenyan, would it be prudent that NHIF is taking care of the police force, while a Mamamboga down there who wants to access service is not able to access? Is that equitable? It is not. So the police wants an enhanced scheme. They can get it from a private insurance provider, while the common mwananchi who cannot afford anything else are able to access through NHIF.
Yes. Talk a little bit about reforms at KEMSA as well.
One of the things that we promise in achieving of this universal health coverage is affordability of commodities. And that is purely the responsibility of KEMSA. Procuring, storage, warehousing, and distribution. We are rethinking on what strategy to use in terms of procurement. And our thinking is towards being able to meet the basic minimum that is required of us in matters healthcare. There's a team that is working on an essential package. Then we shall put together resources. We shall put together different expertise, people with different experience in procuring, so that we have the faith-based, we have the private and the public working together in terms of procurement. So then we achieve economies of scale.
KEMSA has been marred with numerous scandals. This very clear even during the COVID-19 period. Now that you hold office, what should we expect?
So now, it is not even going to be about reforming KEMSA. It is about enabling it to do what it can do best. If it is unable to do procurement, let procurement be done by experts who can do procurement for this country without getting muzzled into all the issues that come around procurement. But it has a lot of capacity in terms of warehousing and distribution.
One of the major issue that your predecessor talked about is how he's going to deal with the cartels at Afya House. What are your plans? How do you plan to deal with them, and not necessarily Afya House, but in the health sector?
Why do we make it look like there are people without faces? Why do we make it look like there are people without names? I know there are companies, but they are owned by people that we know. So for me, in terms of cartels, if you are a cartel, I will tell on you, and Kenyans will know that you are the one who is derailing our moving forward. One of the things that we are going to leverage on is technology. And if you speak to the CEO at KEMSA, they will tell you. I have given them instructions. Simple things like pre-qualification of suppliers. Let us use technology so that anybody can log into a portal and see that this supplier X did not qualify because they did not have Y. You know, there is traceability.
Can we talk about the mess? And now we have governors saying they're not willing to pay for the equipment, the medical equipment in the counties. We're seeing when we go to some of those counties, the equipment is just collecting dust. What is happening?
I want to be very clear that leasing of medical equipment is the way to go. As a government, we are in the business of providing service, not in the business of owning machines and equipment. Therefore, we leverage on those who own equipment to be able to provide a service to Kenyans. What we have done with the existing contracts, we have, I think, two of the contracts that have lapsed. So we are reviewing. We have spoken to the vendors to give us at least 3 months to review. With this new administration, we are working together with my PSS. They have put together a team that is going round the counties to check the condition of the equipment. Then we also have a team that has been put together by Council of Governors to be able to look at this thing and renegotiate, and saying that this was the pricing then because you are bringing new equipment, but this equipment have been with us for some time. Now we are moving into a phase of service and maintenance. Then we see whether to move forward with it or not with it, and maybe with an alternative if need be.
The Ministry of Health has been rated one of the ministries that is most corrupt, with the recent scandal being KEMRI. And KEMRI being on the forefront to highlight it for misappropriation of funds. Considering KEMRI is largely, if not 90% donor funded in terms of the research, where does this leave us as a country?
If a donor has come to put in research money, they're putting into the country for research to assist not just Kenya, but it could be a global solution that can come out of KEMRI. What we are going to do is to look at them and see what is it that then we assist them in terms of reorganizing themselves so that they are able to meet their mandate, as opposed to people privatizing institutions and feeling that they are their own institution. They run them the way they want to run them. No. As I sit here, I'll do the policing bit. Yeah, because it's public funds.
What do you think ails the health sector, and how do you plan to fix that?
The issue of out-of-pocket payments, that most of the people now are paying for their healthcare from their pocket. The other issue that we identified is lack of proper health commodity security. That yes, you have a patient who has been prescribed for an antibiotic in the public hospital, but that antibiotic is not available. So we have a plan, and that is the bigger plan that I spoke to you about. How do we transform KEMSA?
The issue of doctors' strikes have been one that have marred the health sector. And recently we even saw KMPDU had threatened to down their tools if some of the issues at hand had not been met. This was deployment of doctors, internship for the new doctors who just finished school, as well as salary delay among doctors. One thing we've noticed is that some of these issues are recurring issues. What should we expect in regards to issues pertaining doctors' strikes?
So from the strike notice, we were able to bring together the Council of Governors, the Ministry of Health, to be able to discuss the issues. And we eventually unpacked those issues into, I think there were about 9 issues or so. And out of the 9 issues, then we said, okay, this one is national, this is the Ministry of Health, and this one is county. The issues that were for Ministry of Health majorly was posting of interns, which you have seen, we have already posted. A number of issues that were raised were actually to be met by county government. And from the meetings that we had, we agreed on when the Council of Governors is going to meet to be able to thrash out the issues that are supposed to be taken care of by the county government, like the issue of basic salary.
Since you took over the position, what has changed in your life?
I didn't quite anticipate what this position really is. I think on my appointment, it was overwhelming, yes, together with the excitement. But once you start working, then you realize, oh, it's not what I thought it was. And therefore, I'm having to work extra hard. My friends that we just used to meet and chat and have coffee and eat fries on Moy Avenue, I cannot enjoy that. Yeah, because of the nature of the work.
What is one thing that you want to be remembered for?
I want people to be saying, Mama wa afya mashinani. That people, anyone walking into a health facility, they access some form of treatment. That we brought down this heavy monster that people call UHC to the ground level. So the other thing that I want to be remembered for is the minister who brought healthcare on your phone. That you can be able to access your medical records on your phone. We may not get there as fast as Kenyans anticipate, but for sure, there's going to be progress towards UHC. Thank you.
Thank you.
For the full interview, do visit